Hey there, everyone, and welcome back to Senior Health and Wellbeing. I'm so glad you could join us today. We're tackling a topic that's anything but skin-deep cellulitis. Now, before you picture cottage cheese and start craving a bagel, let's clear the air. Cellulitis isn't about dimples on your legs. This sneaky skin infection is a bit more serious. But don't worry, we'll keep things lighthearted and informative. Think of this as a friendly chat about a common health concern. We'll uncover what cellulitis is, how to spot it, and most importantly, how to keep it far, far away from your skin. So grab your reading glasses and your sense of humor. We're about to unravel the mysteries of cellulitis together. Are you ready to become a cellulitis detective? Let's get started. So what exactly is cellulitis? Imagine your skin as a fortress, protecting you from the outside world. Well, cellulitis is like a sneaky band of invaders that manages to breach those defenses. And the culprits behind this invasion? Bacteria, tiny microscopic troublemakers that can cause a whole lot of mischief. We're talking about characters like Staphylococcus and Streptococcus. Now, those names might sound like they belong to a Greek tragedy, but trust me, there's nothing dramatic about them. They're more like party crashers who show up uninvited and wreak havoc on your skin. These bacterial bandits are everywhere, just waiting for an opportunity to strike, and they don't need an open invitation. A tiny cut, a scratch, even dry, cracked skin can become their entry point. Now, here's the thing about cellulitis. It doesn't just hang out on the surface. It likes to go deeper, infiltrating the lower layers of your skin, the dermis and subcutaneous tissue. It's like they're playing hide and seek, but instead of hiding behind a curtain, they're burrowing beneath your skin's surface. And why does this matter? Well, because those deeper layers are where the action is. They contain blood vessels, lymph vessels, and nerves. And when cellulitis sets up camp there, it can interfere with these vital functions, leading to a whole host of uncomfortable symptoms. Think of it this way. Your skin is like a well-oiled machine, and cellulitis throws a wrench right into the gears. It disrupts the flow, causing redness, swelling, and pain. So how does this whole process unfold? Well, it often starts with something small, something you might not even notice at first. A tiny nick from your cat's claws, a blister from your new shoes, even a dry, cracked heel. These seemingly insignificant breaches in your skin's defenses become open doors for those bacterial bad guys. They slip in unnoticed and start multiplying, creating their own little colony right beneath your skin's surface. As the bacteria multiply, your body's immune system kicks into gear, sending white blood cells to fight off the invaders. This battle between your immune system and the bacteria is what causes the area to become red, swollen, and tender to the touch. Now, let's talk about how to tell if those bacterial bandits have invaded your skin's fortress. The first sign is often a telltale redness that spreads outward from the infection site. It's like your skin is blushing, but not in a good way. This redness isn't subtle, folks. It's more like a neon sign flashing, "Attention needed." It's your skin's way of saying, "Hey, something's not right down here. We need backup." And as those bacterial party crashers keep multiplying, the affected area will likely start to swell. It's like they're inflating a tiny balloon beneath your skin's surface. This swelling can range from mild to severe, depending on the extent of the infection. But the redness and swelling are just the beginning. As your body wages war against those bacterial invaders, you'll probably notice the affected area feels warm to the touch. And I'm not talking about a cozy fireside kind of warmth. This is more like a Houston. We have a problem kind of warmth. It's the heat of battle, my friends, as your immune system sends reinforcements to fight off the infection. Those white blood cells are working overtime and they're generating some serious heat in the process. So if you touch the affected area and it feels like you could fry an egg on it, that's a clear sign that something's up. And trust me, you don't want to wait around to see if the yolk sets. It's time to call in the big guns, your doctor. And if the redness, swelling, and warmth weren't enough to get your attention, cellulitis might also throw in a fever and chills for good measure. Think of it as your body's way of throwing a temper tantrum. It's saying, hey, I'm trying to fight off these invaders and I need all hands on deck. A fever is your body's natural defense mechanism, a way to crank up the heat and make things uncomfortable for those pesky bacteria. But let's be honest, nobody enjoys feeling feverish. It's like having a 3-day growth of beard, uncomfortable and itchy. And then there are the chills. 1 minute you're burning up, the next you're shivering under a pile of blankets. It's like your internal thermostat has gone haywire, flipping back and forth between a sauna and a freezer. Now, who are these bacterial party crashers most likely to target? Well, let's just say they have a thing for seniors. That's right, folks. As we get older, our skin gets thinner and drier, making it easier for those pesky bacteria to sneak in. Think of it this way. Our skin is like a fine vintage wine. It gets more delicate with age, and just like you wouldn't leave a prized bottle of wine out in the sun, we need to take extra care of our skin as we get older. But it's not just about wrinkles and fine lines. As we age, our immune systems tend to slow down a bit too. It's like our internal security guards are taking longer coffee breaks, giving those bacterial bandits more time to slip past the gates. Chronic conditions can make us more vulnerable to cellulitis. It's like having a welcome bacteria mat on our doorstep. Diabetes impairs blood circulation and weakens the immune system. A weakened immune system invites bacterial party crashers. They have a sixth sense for vulnerability. Remember, folks, knowledge is power. So, you think those bacterial party crashers might be setting up camp on your skin? Don't panic. It's time to call in the expert, your doctor. They're like the Sherlock Holmes of skin infections, ready to examine the evidence and crack the case. First, they'll give you the once-over, checking for telltale signs like redness, swelling, and warmth. It's like they're searching for clues at a crime scene, except instead of a magnifying glass, they're using their expert eyes and a gentle touch. They might ask you about your medical history, any recent cuts or scrapes, and if you've been feeling under the weather. It's like they're piecing together a puzzle, looking for those missing pieces that will reveal the culprit behind your discomfort. Prescription power-up, sending bacteria packing. Once your doctor has gathered all the evidence, they'll determine the best course of action, and in most cases, that means calling in the reinforcements antibiotics. These little pills are like tiny superheroes armed and ready to fight off those bacterial bad guys. Antibiotics are like the SWAT team of the medical world. It's important to take them exactly as prescribed, even if you start feeling better before you finish the entire course. No encore for infection. Following doctor's orders. Think of it like this. You wouldn't stop watching a movie halfway through just when things were getting good, right? Well, the same goes for antibiotics. You need to see the whole show to make sure those bacterial villains are gone for good. Stopping your antibiotics early is like giving those bacterial bad guys a chance to regroup and launch a counterattack. And trust me, you don't want a sequel to this infection. So, follow your doctor's orders to the letter. Take your antibiotics as prescribed, drink plenty of fluids, and get some rest. Your body needs all the help it can get to fight off those invaders and get back to its healthy, happy self. Now let's talk about what happens when you ignore those flashing red lights and blaring sirens. What if you try to tough it out, hoping the cellulitis will just magically disappear on its own? Well, folks, let's just say it's not going to be pretty. Remember those bacterial party crashers we talked about? If you don't show them the door, they might just decide to settle in and make themselves at home. And when they do, they can create these unwelcome house guests called abscesses. An abscess is like a walled-off city of infection, a pus-filled pocket that forms beneath your skin. It's your body's way of trying to contain the bacteria, but it's not exactly a desirable outcome. Abscesses can be painful, tender to the touch, and might even require a visit from a medical professional armed with a scalpel. But abscesses are just the tip of the iceberg when it comes to complications from untreated cellulitis. In some cases, those bacterial party crashers can get out of control, spreading from your skin to your bloodstream. And that, my friends, is when things can take a serious turn for the worse. We're talking about sepsis, a life-threatening condition that occurs when your body's response to infection goes into overdrive. It's like your immune system has hit the panic button, releasing a flood of chemicals that can damage organs and tissues throughout your body. Sepsis is nothing to mess around with, folks. It's a medical emergency that requires immediate attention. So if you notice any signs of cellulitis, don't wait to see if it gets better on its own. Get to a doctor ASAP. So we've covered a lot of ground today, from the sneaky nature of cellulitis to the importance of seeking prompt medical attention. But the best way to deal with those bacterial party crashers is to prevent them from showing up in the first place. Think of it as implementing a strict no bacteria allowed policy for your skin. And the good news is most of these prevention strategies are as easy as pie and a whole lot healthier too. And there you have it, folks. We've reached the end of our cellulitis adventure. I hope you found this information helpful and maybe even had a chuckle or two along the way. Remember, taking care of your health doesn't have to be all doom and gloom. We can approach even serious topics with a touch of humor and a positive outlook. So stay informed, stay proactive, and most importantly, stay healthy. Thanks for joining me today, and I'll see you next time on Senior Health and Wellbeing. Don't forget to like and subscribe for more senior health tips and lightly humorous takes on important health topics. Until next time, take care and keep those bacterial party crashers at bay.